Pre-eclampsia during pregnancy has become standard of care worldwide. And today in this short video, we will see how our ultrasound can become an important tool for screening women for assessing risk of preeclampsia. The first step would be to locate the placenta. This is important because if placenta is located on one of the lateral walls, the opposite side uterine artery will be showing a high resistance flow. This is because of differential trophoblastic invasion that occurs predominantly on the placental side and less on the opposite side. So here the placenta is posterior, and now I'll be moving my transducer from the suprapubic region towards the one of the iliac fossa to image the iliac artery. So this is your first step in locating uterine artery. And when you switch on the color, the uterine artery is immediately seen as a bright red vessel which is bringing blood towards the placental side. This is your uterine artery. Once the uterine artery is seen, now we switch on the pulse Doppler, put the gate on the vessel so as to include only the artery and obtain a good clean waveform. Remember, we have certain Doppler settings to be kept in mind, specifically the angle of insonation, which has to be between 20 to 30 degrees of its insonation angle. And obviously, if you will be at a right segment when the peak systolic velocity is at least 60 centimeters per second. In this example, though you can see a nice diastolic notch, if you look at the peak systolic velocity, it is around 35 to 40 centimeters per second. What does it mean? It means your gate is closer towards the placental side, and therefore this uterine artery is showing a low resistance flow because of an trophoblastic invasion which probably has reached to that point. If we take this as a parameter, your calculations will be wrong. So we'll have to move away from this site and go to a site where the peak systolic velocity will reach 60 centimeters per second. So once you have moved away from this point and gone away from the uterine artery, now you can see the peak systolic velocity which is crossing 60 centimeters per second, and this is an appropriate area or an correct area to calculate uterine artery values. Of course, if you have moved too much laterally or if your gate is over the iliac vessel, you will get a waveform like this, and this is a typical vessel of iliac artery, and this is not uterine artery, and we can easily identify the iliac artery from this waveform. This information is now entered into a software, and we need to also correlate it with the Pape levels, and the software will tell us what is the possibility of this woman developing preeclampsia. As example, you can see in this patient, the possibility of developing preeclampsia would be 1 in 114, where the cutoff was 1 in 100. This is a protocol. Like we do uterine artery PI at 11 to 14 weeks and combine it with either PAPE or PLGF. If the risk is less than 1 in 100, she is a low risk patient and she will be offered routine antenatal care. If the risk comes as to more than 1 in 100, she is a high risk woman, and we start aspirin 150 milligrams to be taken at bedtime. Never stop aspirin. We will continue aspirin till 36 completed weeks. However, we will repeat the uterine artery PI at 20 weeks. Majority of the women will have a normalized PI by 20th week. That does not mean we should stop aspirin, but aspirin needs to be continued further. If the uterine PI is more than 95th percentile, we will repeat that uterine artery Doppler at 26 weeks to see what has happened. Another significant number of women will have a normalized PI ratio by 26 weeks of gestation, because that is the time when the entire trophoblastic invasion process is complete. But if the woman has still got a high risk resistance flow in the uterine artery, she is a woman who will be really at an increased risk of developing preeclampsia and will require a careful monitoring, maybe frequent antenatal visits and blood pressure monitoring to see if she develops in preeclampsia early, and then appropriate intervention needs to be suggested for this woman.